Now we're going to get into the 4 categories of laxatives, but I want to stress that you shouldn't rely on laxatives to go unless you have been specifically directed to do so by your provider. The first kind of laxatives you ought to know about are the bulk-forming laxatives like psyllium, brand name Metamucil. Psyllium works after ingestion by absorbing water into the stool so that it forms soft, bulky stool that can pass more easily. It is slow acting and you should not expect results until between 12 hours and 3 days after your dose. You must increase your fluid, especially your water intake, for this to be effective. Side effects include bloating, cramping, and gas, the same we see as any rapid increase in fiber. The next category of laxatives are the osmotics. Common examples include magnesium citrate, magnesium hydroxide, also called milk of magnesia, sodium phosphate, the active ingredients in the Fleet's enema, and polyethylene glycol, or Miralax. All of these work by pulling water into the large intestine and stimulating peristalsis, the movement of the gut. You can expect an incredibly rapid onset and for the desired outcome to appear within 30 minutes to 3 hours. This type of laxative is only appropriate for short-term use, a maximum of 3 days, unless otherwise directed by your physician. Side effects include bloating, cramping, nausea, gas, and dehydration. The third category of laxatives are the stimulants. These include senna, Senecot, phenolphthalein, X-Lax, and diphenylmethylate, or Docalax. All of these drugs work by stimulating the bowel lining, causing increased peristalsis. Stimulant laxatives are considered to be the most powerful. Side effects include cramping, nausea, urine discoloration, and diarrhea. The final category of laxatives are the stool softeners. The most common ingredient is docusate, and the brand name is Colace. Colace works by retaining water within the stool to make it easier to pass. Side effects include bloating, cramping, gas, and a bitter taste. If you're unsure about which category of laxatives is most appropriate for you, please reach out to your healthcare provider. I'm the Ostomy nurse providing tips, tricks, and evidence-based information.